So good afternoon everybody. So today we will be speaking about the extended version. Yesterday we have thought about the antidepressant drugs, mood stabilizers. Okay, today we will see some more drugs which affect the CNS, that is antipsychotic drugs. Okay, so by the term psychiatry we mean the person is acting abnormally. Okay, what are the common psychiatric diseases we know? The person is behaving abnormally. Okay, psychiatric disorders, we commonly divide them into anxiety disorders and the non-anxiety disorders. Okay, and in anxiety disorders, that will be person will know that he will be having some normal, what is normal, but in other psychiatric conditions, the person will not be knowing what is happening to him. Okay, that is the anxiety related disorders and the non-anxiety related disorders. Okay, so anxiety related disorders we have already learned some. Okay, that obsessive compulsive disorders and the similar symptoms, like the person becomes angry at a very short duration of time. Even the minute thing which can trigger is excited responses. Okay, so these both type of reactions are there. Now today we will be learning about the non-anxiety related. Okay, though the excessive anxiety can also precipitate this psychotic disorders, we are today learning about the specific psychotic disorders, mainly schizoaffective disorders. Okay. So the most important types of psychosis are schizophrenia. Okay, there are some affective disorders, that is depression, mania, and organic psychosis may be there. That means mentally in the brain there can be some pathways which can be affected there, and that process can lead to organic disorders. Yesterday we have learned that what are the main components, main neurotransmitters which can affect our behavior. What are the main things? Serotonin, dopamine, and noradrenaline. Okay, these are three main components based on which we are preparing our drugs. Okay, so organic psychosis, okay, mental disturbances caused by, it may be head injury, alcoholism, or any other kind of organic disease. Okay, so how this dopamine hypothesis we have found out? Okay, so this dopamine hypothesis, like dopamine, it presents as a neurotransmitter in the brain, can affect the behavior of the person. That is found out with the help of the postmortem studies. PET stands for positron emission tomography. Okay, then the drugs which can increase the central dopamine activity, like L-dopa, amphetamines, they can trigger the psychotic like behaviors. Okay, so we have used these all tools and found out that dopamine levels in excess or in less levels can affect the person's mental status. Okay, so there is also 5-HT, or 5-HT is also called a serotonin hypothesis also. Okay, how it is found out means LSD, okay, lysergic acid diethylamide, it is an abused drug, something like cocaine. Okay, once it is abused, the person will have visual hallucinations. That means the person thinks that something else is coming towards him, where actually there is no such things. Okay, so visual hallucinations, which are more common with LSD, and auditory hallucinations, it is more common with schizophrenia. Okay, so there is also glutamate hypothesis, again phencyclidine, again it is a abused drug. Ketamine, do you remember ketamine? Michael Jackson, he was killed due to his own drugs. Okay, so ketamine was involved there. Then any drugs which are abused, they can produce such psychotic behavior. Based on these hypotheses, they have found out the basis for glutamate, 5-hydroxytryptamine, and dopaminergic systems. Okay, so this I will be going in brief. Okay, there are so many pathways, okay, so many interconnections within the brain, so that they can normally function. Okay, so this dopaminergic systems, just it's a introduction. Just remember the pathways, such pathways are existing. Okay, there is nigrostriatal pathway, mesolimbic pathway, tuberoinfundibulary pathway, okay, then medulla oblongata. So on affecting these systems, like basal-limbic system is affected means behavior is involved, tuberoinfundibulary pathway is affected means endocrine system, medulla oblongata it is affected, vomiting, like that. Okay, like psychosis, schizophrenia, there may be positive symptoms and negative symptoms. Positive symptoms are like hallucination, delusion, okay, all these things. Negative symptoms means social withdrawal, emotional blunting, extreme inattentiveness, okay, all these are there. Positive symptoms, it is relatively more chances that the person will recover earlier. Okay, negative symptom means the person will have, along with the psychotic features, he can also have a depressive symptoms. Okay, so the recovery chances or recovery time taken in negative symptoms will be more. Okay, where dopaminergic receptors are present. Okay, there are 5 subtypes of receptors. We will just ignore them. Okay, we will directly come to the classification of the antipsychotic drugs. Okay, so typical antipsychotics are there. Here we have the important drugs only I will explain. Okay, chlorpromazine, then fluphenazine and thioridazine. Okay, chlorpromazine, fluphenazine and thioridazine. Okay, thioxanthine, it is the Flupenthixol. Now the advantage of this Flupenthixol is it can be given one dosage, once in 2 months, like that. Okay, previously the patient had to take the drugs every day. Now the injections of Flupenthixol, in case of schizophrenia, they are using in a monthly dosage. Okay, then come to the next group, the Butyrophenones. In Butyrophenones, the top drug commonly used was haloperidol. Okay, haloperidol, droperidol and domperidone. Have you heard this term, domperidone? Yes, domstol or domperidone, it is commonly used for vomiting. Okay, to prevent vomiting we are using this drug, but this drug also has the antipsychotic activity. Its base structure is similar to our haloperidol. Coming to the miscellaneous antipsychotic drugs, that is pimozide, molindol and sulpride. Okay, atypical antipsychotics are clozapine, quetiapine, risperidone, sulpride and olanzapine. Okay, what is typical and atypical? Okay, typical antipsychotics, they directly affect the dopaminergic pathways. Okay, so those drugs which affect the dopaminergic pathways, they are typical antipsychotics. Atypical antipsychotics are those drugs which have, along with that action, they have action on the serotonin receptors. Okay, they have less activity on this dopaminergic receptors. Why we are having this atypical antipsychotics means the typical antipsychotics which we described before these slides, all are having major side effects in the form of extrapyramidal side effects. Okay, so here with the use of this atypical antipsychotics, there is less chances of this extrapyramidal side effects. Commonly are Parkinsonian-like features. So, coming to the top drug of this group, that is chlorpromazine. So, the pharmacological effects and mechanism we need to know here are, then CNS, we have neuroleptic effect. Okay, so antipsychotic drugs probably owe their therapeutic effect mainly to the blockade of the dopamine receptors. Okay. Antiemetic effect, okay. Antiemetic effect inhibits it is by inhibiting the CTZ. Okay, CTZ is chemoreceptor triggering zone. Then temperature regulation, it is also affected and it can produce hypothermia. Okay, so how this dopamine is working? Okay, so dopamine is helping in increasing the mood or decreasing the mood? It is helping in maintaining the mood elevation and all. Okay, yesterday we saw 3 circles, no, where we saw that the moods, everything, that behavior, everything will be affected by our dopaminergic pathways. If it is excess, the person may go for agitation, all these things. Okay, so we have to maintain this normal dopaminergic levels. Coming to the other pharmacological effects which we see with these drugs, that is chlorpromazine. Okay, in chlorpromazine, it affects the autonomic nervous system also. It is an unwanted effect here. Okay, by blocking the alpha adrenergic and cholinergic receptor. M stands for muscarinic receptors. In cholinergic we have muscarinic receptors. Okay, so and results in hypotension, dry mouth, constipation and blurred vision. So other endocrine systems, how it is affecting is, it increases the release of prolactin and decreases the corticotropin release. Okay, so release of prolactin, it is good if she is a mother, but in mothers we tend to decrease the use of this antipsychotic drugs and use the very safer atypical. If at all we need to use them as by restrictions. Okay, so if this prolactin is released in a normal person where it is not, and a person may be male, okay, there can be other bad effects which are unwanted. So coming to the next group, that is Thioxanthenes. The drug is Flupenthixol. Okay, it is a milder antipsychotic agent, okay, and anti-anxiety and anti-depression action. Okay, it is a combo-like effect. Okay, all the three effects are there. Coming to the Butyrophenones, haloperidol. Okay, so here haloperidol, we need to know that it is a classical antipsychotic drug which was used from lot of more than 3 decades, I think, and it will be more research as the drug is older and it is more research, and it is having lot of side effects mainly due to the extrapyramidal side effects. It is by virtue of its blocking of the D2 receptors. So here it has lesser incidence of autonomic side effects. Okay, autonomic side effects means, you know, what is the autonomic system in the body? That is sympathetic system and a parasympathetic system. So the drug which we are using for this antipsychotic effect should not affect those autonomic purposes. Okay, so in that this drug is comparatively better. So it is drug of choice for Gillis-Dorr-Diller syndrome and Huntington's chorea. Huntington's chorea is a typical walking style, or a person will go for abnormal muscle contractures which appears like the person is dancing. Okay, if a person is moving according to his own will as normally, but it appears that the person is going for dancing or something like that. Okay, so adverse effects, as with any other typical antipsychotics, we have the extrapyramidal side effects. I will be dealing with these extrapyramidal side effects later. Okay, coming to the atypical antipsychotics. Okay, atypical antipsychotics, I told the mechanism of action is not mainly dopamine receptors, it is 5-hydroxytryptamine receptors or the serotonin receptors. Okay, based on by virtue of this action, they have lesser side effects. Okay, so low incidence of EPS stands for extrapyramidal symptoms, low sedation, no gynecomastia, because we learned that in the previous slide there was prolactin induction with the help of with the virtue of dopamine receptor action by haloperidol, but here we do not have such action, so there will not be chance of gynecomastia. What is gynecomastia? It is male developing the enlarged breast. Okay, coming to the quetiapine. Okay, again it has primary action on the 5-HT receptors. Okay, so the clozapine, important point we need to remember is adverse effect with clozapine is agranulocytosis. Okay, coming to the next drug, that is risperidone. Do you understand what is agranulocytosis? Decrease in the blood cell counts. Okay, so blood cell counts will be decreased due to the inhibition of its production. Coming to the next drug, that is aripiprazole. Okay, it's a partial agonist at dopamine D2 receptors and 5HT1 receptors. Okay, so it is a dopamine serotonin stabilizer in the CNS, and it has a longer T half. T half means therapeutic half-life, okay, of 3 days. So 3 days, once in 3 days dosage may be enough for the person. Coming to other drugs, okay, certindole, it is again having long plasma T half. Okay, so it is more effective in negative symptoms compared to positive symptoms. It is important to us because I told now, in case of negative symptoms, the recovery period will be delayed. And it has less liability to cause extrapyramidal symptoms because it is agonist at dopamine receptors, and once these dopamine receptors are not inhibited, okay, the symptoms of this extrapyramidal side effects will be low. Here in psychosis, okay, there is excess of this dopamine. Okay, the dopamine is in excess, then only the person is thinking of this having this psychotic behavior, and we are decreasing the levels of dopamine. Okay, normal levels of dopamine are also required for the normal functioning, but when we are using such drugs where the dopamine levels are decreasing day by day, okay, after continuous usage, what can happen? The normal functions which was carried by this dopamine levels in the body, that can also be affected, and the person may get Parkinsonian disease. Have you heard of Parkinsonism? Yes? Okay, Parkinsonism, how do you remember? The disease as RAD symptoms. R for rigidity, A for akinesia, T for tremors. Okay, we have RAD symptoms. Okay, resting tremors, akathisia or difficulty in movement of the limbs, and tremors. Okay, all these three symptoms are there. Parkinsonism, it also has other symptoms. It is a age-related disease. You need to remember that part. Okay, this chart is not needed. Coming to the pharmacokinetics. Okay, so most antipsychotics are readily but incomplete absorption is there. There is significant first pass metabolism. Have you heard of this first pass metabolism? Yes. What is happening? Before absorption into the intestine, it has to go through, before entering the blood levels, it has to go through the oral pathway, maybe the intermediate pathways which are withdrawing some amount of the drug, and the amount of drug which reaches the systemic circulation will be maybe 30%, 40%, and maybe as low as 10%. Okay, that is something related to our first pass metabolism. Bioavailability is 25 to 65%. That means fairly low bioavailability. So more highly lipid soluble. Okay, for any psychotic drug, if it is highly lipid soluble, it can easily enter the brain. That part we need to remember. And highly plasma protein bound. Okay, if the drug is highly plasma protein bound, its duration of action in the body will increase, and the drug available for the action will be less. Okay, so the drugs which are highly plasma protein bound, their levels in the body can remain in the body for longer time. Okay, the maybe therapeutic or subtherapeutic concentration, when it is plasma protein bound, the duration of action will increase. That's why even though you have stopped the antipsychotic drug today, their action may be there till another 1 week or so, because of the T half and because of the biological adoption which has taken place. And we have already discussed yesterday that SSRIs, SNRIs and tricyclic antidepressants, their action only starts after 3 weeks. Okay, that means it takes some time for adoption of the body or biological amines, and for withdrawal also the same thing follows. Here there is slow elimination also. So duration of action will be longer than expected, and metabolites may be present which can act for weeks together. Okay, therapeutic uses. Where we use this drugs? The common disorder where we use is schizophrenia. Okay, and there are schizoaffective disorders. Mania, paranoid status, alcoholic hallucinations, all these things may be present. Okay, so drug-induced psychosis, are there any drugs which can induce psychosis? Yes. Okay. The drugs which can be used for treatment of this Parkinsonism, okay, such as levodopa and carbidopa, they can induce a psychosis-like condition. Okay. There are some other drugs called MAO inhibitors, monoamine oxidase inhibitors. These drugs can, after long time, induce psychotic behavior. Okay. So aging is a bad part. If you use one drug, it can cause another disease. Antipsychotic drugs can cause Parkinsonism. Anti-Parkinsonism drugs can cause psychosis. Okay. Anti-Parkinsonism drugs, after long time use, they can induce a psychosis. And this antipsychotic drugs, after long time use, can cause Parkinsonism. So don't get aged. Be young. Okay. See, these are the diseases related to age. I am not telling that young age you cannot get psychiatric disorders, but Parkinsonism and all, these are age related diseases. Okay. Coming to the next, Huntington's disease again, where here we can use this drug. And pre-anesthetic medication, yes, the person becomes hyperreactive, so we need to calm the person, where we can use this drug. Okay, intractable hiccups. There is continuous hiccups. Maybe we first starts with the antacids, everything. The person is not relieved of its hiccups. Final treatment will be using of this chlorpromazine 50 mg drug. Okay, it can reduce this hiccups. So here a neuroleptic is a antipsychotic drug. Okay, so it has the positive action and the negative action. I am just trying to explain it here. Okay, the negative actions are here this side. Okay, muscarinic receptor blockade. Okay, or this, once these muscarinic receptors are blocked, it can cause dry mouth, blurred vision, difficulty with maturation and constipation. And here it can also go for alpha adrenoceptor blockade. It can cause postural hypertension and hypothermia. It can also release this histamine and serotonin receptor blockade action is also there. Well, what happens if there is dopamine D2 receptor blockade? Okay, here endocrine side effects is gynecomastia, galactorrhea because of prolactin release, menstrual irregularities, impotence and weight gain. Okay, all these symptoms are not required. Okay, again coming to the effect on this basal ganglia, I told now if we use this antipsychotic drugs for a long time, what we can get? The primary diseases, Parkinsonism, then dystonia, tardive dyskinesia. Okay, tardive dyskinesia is frequent oro-buccal labial movement. Okay, the person will be moving like fingers, everything again and again. That is uncontrolled movement from the person. He may not be doing it purposefully. Okay, so these are the side effects after using this antipsychotic drugs for longer time. So there can be other adverse effects, okay, other than what we have studied in the chart. Okay, behavioral side effects may be pseudo depression and neurological symptoms. You already learned this: Parkinsonism, dystonia, tardive dyskinesia. Okay, so tardive dyskinesia is comprises mainly of involuntary movements of the face, tongue. Okay. Coming to the other adverse effects, okay, hypertension. I showed that there is affection of the alpha adrenergic receptors. Okay, metabolic and endocrine effects. Yes, weight gain, toxic effects. Again, agranulocytosis. It is common with clozapine. Okay. So ocular combinations can be there, and cardiotoxicity by affecting the normal rhythm. T-wave abnormality can be there. There is one disease called as Neuroleptic malignant syndrome. Okay, it is most common with haloperidol. What is that? It is a life-threatening. What can happen here? Marked muscle rigidity, sweating, okay, autonomic instability, high blood pressure. Okay, finally it can go for arrhythmias. Finally, the patient may collapse in death. Really, these symptoms can occur. Okay. This was in brief about this antipsychotic drugs. So, have you heard of this antiepileptic drugs? Antiepileptic drugs. Epilepsy means what? Yeah? convulsions. Very good. Okay, the common term used is dental fits, no? Have you heard of it? Yes. Okay, so we'll study this commonly used anti-epileptic drugs. Okay. So what exactly is this epilepsy? Epilepsies is not a particular disease. It's a group of disorders of CNS characterized by paroxysmal cerebral dysarrhythmia. Okay, if the heart is beating regularly, we call it rhythm. If it is not correctly beating, we call it as arrhythmia. Okay, here there is a arrhythm with the brain activity. The constant impulses are not sent. There is high frequency of impulse sent in the brain. That is causing the disturbance. So we can call it a cerebral dysarrhythmia. Yes? Yes. Okay. So manifesting as a brief episode. Okay, it is lasting for a short time. Brief episode of loss of consciousness without characteristic body movements. Maybe the person may have a partial convulsions. One limb may be moving, both one side of the body may be moving, or the whole body may be having involuntary movements and having a sensory or psychiatric phenomena. Okay, can we summarize that? Epilepsies are the group of disorders of CNS characterized by paroxysmal cerebral dysarrhythmia manifesting as brief episodes of loss of consciousness. Person will not be knowing what is happening to him for that particular moment. Okay, manifesting as brief episodes of loss of consciousness with or without characteristic body movements, sensory or psychiatric phenomena. Okay, coming to the classical group, okay, where whole body is involved. We call it as GTCS or generalized tonic-clonic seizures. Okay, and it is a major one, and it is also called as grand mal epilepsy. It is commonest type of fits, okay, or commonest type of epileptic disorder what we have seen. And the time taken for this is 1 to 2 minutes. Okay, so there will be sequence. How the sequence is there? Okay, initially the person once getting this epilepsy, what happens? He will be knowing, okay, I am getting some problem now. My head is starting sensing something. He will notice that, because after 2 or 3 epileptic attacks, he will notice, okay, I may get this epileptic attack now. That feeling he will get. That is called as aura. Okay, aura is there. Then he will start crying. Okay, I have some problem. He feels like crying. Then the person will go for unconsciousness. Then tonic spasms. Then clonic jerking is there. Then prolonged sleep. After that, he will go for sleep. And finally, CNS depression may be there. Okay, so I just show you brief thing how this will occur. You can see a patient sitting there. Okay, just remember aura followed by a cry. No, he is stopping. He is getting this aura. Okay. See, it is starting with a limb, one side. Okay, after that he is getting a tonic jerking movements. After this episode, he may go for a sleep for some time. Okay. It is generalized. Whole body is involved. Okay. Can you see that whole body is involved? Yes. So after which, he will go for a sleep. What we are doing there, we are trying to suck out the secretions which may enter the respiratory system. Okay. Okay, that was it. Okay, aura, cry, unconsciousness, tonic spasm, chronic jerking, progressive sleep. Okay, so it is. Then the next one is absent seizures. Okay, it's a minor and it is also called as petitmal. Okay, here it is common in children. Okay, what happens? The baby will be sitting normally, but just for a moment of 30 seconds, the baby loses its consciousness, and the baby will not notice that also. Okay, that I will show you. Here what we are telling, we are trying to blow the child to a paper. Okay, so after this physical exertional activity, what will happen? The baby will stop doing that for a particular moment. Okay, you can see here, baby stops momentarily. She goes blank after some time. Can you notice that? Okay, now she will start. She has stopped. Okay, this is the absent seizure. Okay, for a particular moment, the baby will lose its consciousness. Okay, patient apparently freezes and stays in one direction for a small duration of time. It is one more baby having the same symptoms. I'll show it later. Okay, then coming to the atonic seizures or akinetic seizures. Okay, so here there is unconsciousness with relaxation of all the muscles due to excessive inhibitory discharges. There are other minor seizure activities, that is myoclonic seizures and infantile spasms. Okay.